you actually show me where the pain is? So
It's been basically here in the lower backs.
So it's mostly here on the left side? Not really here.
Yeah, on the left side.
Right here.
Yes.
And then when it's over in the shoulders, where do you feel it?
It's the upper shoulder, here on the bottom.
Right here.
And then also the neck right now, I've been feeling that pain.
Do you get headaches?
I've been lately getting headaches.
Through here?
Yes.
Okay. Is it more on one side than the other side?
Yeah, I feel like more on this side.
Okay. Well, we definitely see a lot of asymmetry here. I mean, you notice that your shoulders are, unlevel.
Yeah.
Yeah, we can definitely see that. But actually, the whole thing is the crease, everything over here is actually unlevel too. Your whole skull is actually lifted up. It looks more so than actually on the x-rays. This is actually a lot more tight than this side. Can I poke here? Is that painful?
Yes.
Okay. When you move to the sides, does this bother you?
Yeah.
That hurts?
Mm-hmm.
Okay. This one less?
It's less.
Yeah, okay. Mm-hmm. And this one's a little bit more.
Right there?
Right there. So if I go a little bit more than that, is that?
Yeah, it hurts.
Okay, so as you go more and more, it hurts more and more. Okay. So we're gonna do the same thing. You let me know if it's the same or the.
Yeah, it hurts.
It hurts going that way. Okay. And here.
Yeah. Also.
Oh, that hurts too.
Yeah. That's funny. I was standing up hurts more than sitting.
There. A little bit here too.
Mm-hmm. I feel it.
You feel it?
Mm-hmm.
Yeah. I'm seeing an inflammatory reading over there too. Right there?
Mm-hmm.
Yeah.
Right there.
A little bit here. Okay. Ooh, okay. Get a reading right there. Is this painful too?
Yes.
Okay,
Mm-hmm.
that's pretty painful.
Mm-hmm.
Remember how I said your spine is rotated? Well, it's actually your sacrum that's rotated. This side is more indented and this one's more popped out. That actually can rotate your whole spine off to that side too. So originally I actually thought it was a lumbar problem, just when you were talking about waking up in the morning, that's it. But I actually think it's more on that side. So your shoulder being on level is really obvious, but your left leg is actually turned in more and your right leg is turned out more. Did you already know that about yourself?
This one turns more like this.
Yeah.
Yeah.
That's painful right here, right?
Mm-hmm.
Okay, so your head is actually higher than it actually looks on the x-rays. And we can show you on the video, but it's actually high up on that side. So what I'm going to do is actually shift one of the bones down so it actually starts leveling out your head. That should help actually a lot with the headaches over there. And then we're going to adjust over here because you got that hunchback that's going on, so we're going to start working on that. But definitely the sacrum. So like I said, this is actually twisted, right? So we're going to actually push that back. Okay, so let's start working. Right. I'm going to be shifting this down, okay? So just relax. Good.
Wow. Wow, that's a lot of popping.
Yeah. A little different than what you got before, right?
Yeah.
Even with that, your ears are like definitely a lot more level than they were before. Good. A little bit more. Good. Good. That was the rest of it. What do you notice? It can be good, bad, anything that's changing. I'm going to put notes in.
It's a little bit better.
Okay. So where are you noticing this starting to even out over here? Yeah. That's good.
I mean, it's less. It seems like I can be sitting, stand a little bit longer, and one way instead of have to be getting it more straight or not arching.
Okay.
Yeah, it definitely helps. No, it feels better. It feels better. I don't feel much as the pain than the first time I can.
How's your neck doing?
Yeah, I feel good.
Good. Okay. That wasn't too bad, right?
No, it was good. No, it was good.
Good. All right. Let me know next time.
Sounds good. Thank you.